I'm Dr. Sandeep Gore. I'm a Director Emergency Medicine, Fortis Hospital, Mulund, Mumbai. Today we are discussing on the antimicrobial resistance awareness. The week which starts from 18th of November to 24th of November is considered as World Antibiotic Awareness Week. And for this year 2022, the theme is that preventing antimicrobial resistance together. This is a very important thing. And the theme is that antimicrobials handle with care. Emergency department is one of the important area of any organization where antimicrobial treatment get initiated. So the importance of emergency medicine department in starting the antimicrobials is of very important. And at the same time, I can say the awareness about the antimicrobial is very important because rapidly we are getting very much many antimicrobials resistance to the different type of pathogens. How to prevent it? So we should not be use irrational antibiotics while delivering the patient care. Any higher antibiotic which is we are prescribing, whether it's in IV or it can be oral antibiotic, there should be rationally behind its prescription. Surviving sepsis guidance says that one should deliver first dose of antibiotic within 1 hour of arrival to the emergency department in a suspected sepsis patient. But at the same time, one should deliver the appropriate antibiotic also. And the criteria to give the antibiotic is the Q-SOFA criteria. Based upon that objective criteria, one should start the antibiotic. At the same time, while delivering the antibiotics at the OPD basis, we have to use the criteria like a Centaur criteria which NHS use for tonsillitis. Very much conservative criteria these things. We have to use such type of objective criteria for giving antimicrobials for any OPD patients there. At the same time, some viral infections like dengue and all these things, in such situation one should refrain to prescribe antibiotic. So when a medical fraternity use antibiotic in a rational manner, when they start writing a justification for each antimicrobial they are prescribing, especially in higher antibiotic, I think we can control these things.
हेलो एवरीवन, मेरा नाम डॉक्टर वैती है। मैं फोर्टिस हॉस्पिटल मुलुंड में आईसीयू का एसोसिएट डायरेक्टर हूँ। 18th November to 24th November is being celebrated as Antimicrobial Awareness Week. I believe that it is very important. हम सब के लिए ये बहुत ज़रूरी है कि हम इसको अप्रिशिएट करें कि जो एंटीबायोटिक्स है, जो मेडिसिन्स है, जो इन्फेक्शंस में काम आते हैं, ये मेडिसिन्स हमेशा अवेलेबल नहीं थे। पिछले 100 साल पहले इसकी डिस्कवरी हुई है, उसके पहले ये मेडिसिन्स नहीं थे। और उसके पहले जो हॉस्पिटल्स और उसमें इलाज होते थे, जो ऑपरेशंस होते थे, उनका आउटकम्स और उनके रिजल्ट्स इतने अच्छे नहीं थे। Antibiotics has been boon for us over the last 70 to 100 years, which has improved the outcomes in the hospitals tremendously. And आज जो हम survival rate देखते हैं दुनिया भर में, it is because of the antibiotics, I'll say, to much extent. But it is important that we understand कि इसकी ये कितनी ज़रूरी है और इसका यूजेज क्यों हम कंट्रोल में रखना चाहेंगे। बिकॉज एंटीबायोटिक्स लिमिटेड है, एंटीबायोटिक्स अनलिमिटेड नहीं है। बहुत ही गिने चुने दवाइयाँ हैं जो असर करते हैं बैक्टीरियाज के ऊपर, और इसका जो उपयोग है वो सही तरह से होना बहुत ज़रूरी है। इनडिस्क्रिमिनेट यूज़ ऑफ एंटीबायोटिक्स इज़ नाउ द बिगेस्ट थ्रेट टू ह्यूमन्स। इट इज़ बिलीव्ड दैट इन द नेक्स्ट 20 to 30 years, अगले 20 से 30 साल में हमारा एंटीबायोटिक यूजेज इतना हो गया है कि हम एंटीबायोटिक रेजिस्टेंस फेस करके हमारे जो 100 साल पहले का जो नतीजा था वैसे ही होगा, ऑपरेशंस के रिजल्ट्स अच्छे नहीं होंगे। तो आज इस घड़ी पे ज़रूरी है कि हम अप्रोप्रिएट यूज़ ऑफ एंटीबायोटिक्स करें, रैशनल यूज़ ऑफ एंटीबायोटिक्स करें, इनडिस्क्रिमिनेट यूज़ ना करें। जनरल पब्लिक शुड ऑल्सो नो कि दवाइयाँ जो है, हर बीमारी का इलाज एंटीबायोटिक्स नहीं होते और उसको सही तरीके से सही ढंग से उसका इस्तेमाल करना ही सबसे ज़रूरी है।
Hi friends, I am Dr. Rahul Pandit. I am the Director of ICU for Fortis Hospital, Mumbai. The World Antimicrobial Awareness Week is starting from 18th of November and will be celebrated for the week going up to 24th of November. Now, I wish to sort of bring out a few points which have been discussed for so many years by us. Most importantly, it is about antimicrobial resistance. And I really feel that we as doctors, as healthcare workers, as healthcare professionals are equally responsible for the antimicrobial resistance which is spreading. Quite often we talk about animal industry and the use of antibiotics there, but we are equally responsible for the antimicrobial resistance. So we need to shoulder this responsibility because there are no new antibiotics on the horizon. Even if an antibiotic is being developed, it will take billions of dollars in at least 10 to 15 years for a new antibiotic to come out. So what we actually have in our hand right now is the current set of antimicrobial agents. And if we have microorganisms which are actually going to be resistant to these antibiotics, we are going to have a difficult time ahead. We are already seeing a lot of it happening in our hospitals. So let's do a few things. First and foremost, whenever we are prescribing an antibiotic, take a step back and think, do we really need to prescribe it? If we are really finding it that it needs to be prescribed, then choose the most appropriate antibiotic for which the organism is likely to be sensitive. Use the correct dose, correct duration, and correct time for that to be given. Always consult with your infectious disease specialist and your microbiologist before making a decision to start antibiotics. Empirical antibiotics or preemptive antibiotics should not be used unless they are really being used for a preemptive purpose. And we find that most of the times these antibiotics are very loosely prescribed. So let's be responsible doctors and healthcare workers and only prescribe antibiotics when they are necessary. Another problem which I find is a winning combination. If we go on a broad spectrum antibiotic and then we find that the antimicrobial agent, actually a much narrower antimicrobial agent, might be useful in this particular scenario, we are very often very hesitant to actually downgrade the antibiotics. So let's try and put the antimicrobial stewardship program in its true spirit and word and try and make it work in such a way that we bring down the antimicrobial resistance in our hospital quite rapidly and dramatically. We have been successful in doing that around 3 or 4 years ago, and I urge all my colleagues in the hospital to contribute to the antimicrobial stewardship program to make it a success, and let's utilize this awareness week to spread the message across. Thank you very much.